Hi there. I'm Amanda Makulec, and I'm the Operations Director for the Data Visualization Society. Today, I'm really excited to be talking with Brandi Harless, who is the Mayor of Paducah, Kentucky, and someone who I know from when I was doing my Master's in Public Health at Boston University. Brandi, it's so great to talk to you today.
Well, thank you, Amanda. It's good to see you. It's been a while since we've seen each other in person.
I know.
But
Maybe back when you were in DC passing through for some fancy mayor summit a couple months or years ago.
Yeah, it makes it sound like I've been the mayor for a long time, but 3.5 years in.
3.5 years. All right. So Brandi, tell us a little bit about yourself and about your background and kind of the unique position you're in right now as someone who's has a background in public health and also is in this position of government service.
Yeah, sure. So I am originally from Paducah, Kentucky. I moved away for about 10 years, and I always say I accidentally moved home in 2009. And that's a longer story for a different webinar, a different video. But when I did, and I decided to stay home, I decided to figure out a way to give back to my community. And before I knew it, I was running for political office for the first time ever in my life. I was never the kind of person who had political inspiration or aspiration at all. But I ended up winning against the incumbent. And I've been serving since 2017. And it has honestly been one of the joys and one of the hardest things I've ever done, I'd say, in my life to date. And so now, knowing that I am the mayor at a time that's unprecedented in public health, and that I was prepared for this moment as much as anyone can be prepared. Let's be very clear about that. I'm thankful that I'm serving my community during a time when I can bring my understanding and expertise to the table in a position that oftentimes doesn't have that level of expertise and experience.
Yeah, what a unique lens to bring. So, Brandi, if someone's not familiar with Paducah, Kentucky, where it is it the Eastern or the Central time zone? I know I mixed that one up. What should someone watching know about Paducah, Kentucky? So, how is the story right now in your community different from what we're seeing in other parts of the country?
I love that question. Well, just so you know, geographically, we're on the far western side of the state. The time zone cuts Kentucky almost in half. We are on the central time zone. We are about an hour and a half north drive of Nashville, about 2 hours from Memphis, 3 hours south of St. Louis, and about 3 hours west of Louisville. So if you kind of imagine we're kind of in the central part of the United States. People always ask me the population of Paducah, and I typically say we sleep 25,000 people, but we serve about 120,000 people a day. We're the regional hub for healthcare, for employment, for education. So we have to program a lot of our city services for a larger population than actually we have when we think about police and fire and those kinds of things. Right now, I think it's interesting to consider. I haven't had a lot of time to look up outside of my own community and really kind of compare. I will say that we're holding pretty steady in my county alone. Kentucky is such a weird bird. We have 120 counties. Someday in the future of my life, I hope to see some of those merge, but people have tried over and over again, and it doesn't happen. But in my county, McCracken County is the name of that. We have only 30 positive cases here at this moment. In our region, we have a little over 100 in the 9 counties around us. Our 2 local hospitals are the regional hospitals. They have a catchment area of about 500,000 people, and they service across the state lines. So you can see it's a very interesting phenomenon to be in a small city, but have such big amenities and really big services that we're offering to the region. So it puts us in a little bit of a different perspective, because I can't only look at my cases and my information. I have to be looking at the region around me, because it will impact what happens in my local economy.
Sure. It makes me think of some of the kind of unique ways we've seen geography mapped around COVID. There was an interesting ProPublica piece looking at hospital referral regions and their hospital referral areas instead of looking at just counties, because it was trying to find a way to make better sense of kind of how people actually access services, which isn't necessarily based on administrative lines, which I think is a really great call out and something I can tell you're experiencing personally. I'm curious, kind of as you're looking at data yourself and looking at these maps and charts and graphs, what's the data that you're looking and watching on a day-to-day basis or a week-by-week basis to try to inform the decisions that you're making for your community right now?
I'm going to be really honest with you. And I thought about this because I knew we were preparing for this video. And the fact of the matter is that there's so much, and the word controversy is probably too strong of a word, but there's just so much back and forth about what data to trust and what data is helpful and what data isn't helpful. And in Kentucky, our governor took the steps kind of on our behalf. In the beginning, he made the executive orders that we as local officials have to follow by state law. And so we haven't had to make as many decisions locally. However, as a public health person, I am very interested in kind of monitoring what's happening. And my new focus is really this conversation around how do you reopen the economy and still be safe? And so all of the benchmarks that are coming out, the conversations around the White House phased approach, our governor is adopting that to some extent and talking about those benchmarks. But when you start looking at that in more depth, it does have to be looked at on a more regional basis. It can't be looked at across the state. And so I'm curious about things like, when we start talking about cases, and we have a lot of our citizens who want to compare Kentucky's cases to the states around us and say, well, we're worse off than some of those states around us. But then you have to look at, the whole denominator search that people talk about. Or how many how many tests do we have going on? And I feel like that level of data, the case rate, this focus on how do we make sure we're comparing across apples to apples has been something that I've been very frustrated by. I even think the data that you sent me today, or it was today, the mapping of tracing the flattening of the curve, I still had questions about what are the underlying assumptions in that data. And so I know that if I understand that, not every mayor does. And so a lot of times it's, to me, it's a little bit worrisome that possibly people are making those decisions and they're really making political statements based on some of that data. And that's, I think, the hardest thing for me is I have citizens making these very political statements about, well, Governor Beshear shut down our economy, but and he keeps saying that we flattened the curve, but then in Tennessee, they have less cases, but they're opening the economy back up. I mean, so I guess I'm just rambling for you right now, but it is something that I'm continuing to kind of get a little concerned about because I have citizens making decisions based on this, not just me making decisions.
Sure. Or citizens who are going and looking to hold people accountable for decisions made based on what at the end of the day is really uncertain, incomplete data. I mean, I know I haven't seen any real analyses down at the state level, but even looking at the national level and some of the estimates from the London School and other groups, trying to make sense of how many actual symptomatic patients we're actually capturing in our numbers. And those ranges are in that 10 to 20% range, which means that there's just a lot of gaps in our data. And I think that that's one of the unique things about being in public health is that we had to study how these different pieces happen and how contact tracing works and how disease spreads. And so it gives you a really unique lens as you're trying to make sense of that. How do you try to communicate that complexity and that uncertainty to people in your community who may not have that same background or may not be as excited about digging into the complexities of how national surveillance data is collected on a disease?
Well, that's a really good question. And the best that I have been able to figure out how to do is I do these daily 6 p.m. update videos, and they tend to last anywhere from 10 minutes to 20 minutes, depending on what I'm talking about. And, my undergraduate degree is actually in communication of science and technology. So I feel like I'm a little bit prepared to be able to take a lot of that jargon and turn it into something that's usable in a lot of ways. And I've tried my best to figure out how to do that. I think for me, it's about picking out the essence of the recommendations. It's picking out the essence of those benchmarks and being able to kind of break them down into how they are reality for us. And I'll give you an example. This concept of needing this kind of, massive community-wide testing is a big conversation right now that I've been trying to break down for our community. And, to date, we've only really had testing in our community and really in the state of Kentucky for people who've had symptoms. But the reality is, as we all very well know, we need to have testing at much more greater levels than that. No one believes that we can test everybody every day, but we need to do better than just testing people with symptoms. We need to have serology testing. We need to be able to test people who've been exposed to positive cases. And so I've been having that conversation with my community about the next step is for us to be considering how to get testing available for those who've been exposed to people who are positive. And the good news is we actually have a local community task force that was put together by some doctors and some philanthropic community foundations, and they are funding testing with that like kind of loosened eligibility criteria. So that's the good news in our community, that we were able to do that. And I think the more people can see that and kind of get an understanding of what that means to loosen the criteria up, the better off that they are in the long run, as we ramp up testing even further, hopefully, in our state.
Sure, and trying to make that more accessible to everyone. I mean, I'm not very familiar with the demographics in your region, but I know we've seen different communities being impacted in different ways by COVID-19. Is that a really acute issue for you where you are, or is that something that's a bit displaced or something that you're not dealing with as acutely?
It's not as acute in our region. I know that the governor started to share demographic information about positive cases across the state, especially because of Louisville and Lexington and the diversity there from just a sheer like ethnicity and race perspective. In rural Western Kentucky, we don't have as much of that going on. And to be honest with you, we haven't had enough cases to really merit jumping into it. With 30 cases in a county, you don't have a whole lot of data to play with right there when it comes to that. So we haven't necessarily been focusing on that to date.
It's funny, all the sample size pieces and denominators make me think of Bill Bicknell and all of the things he talked about back in our global health policy classes, all around the different ways that we had to think about those things and think about kind of how people are represented in the numbers. And I think when you're still at a small sample, it's much more obvious that those are each individual people and stories. And I know I've been worrying about kind of as I see some of the charts and graphs come out, that they lose a bit of the humanity. So I guess I'm curious if as you've watched kind of the story unfold and given your background in scientific communications, I mean, what charts or graphs or stories have frustrated you that you've seen in the news media?
Oh, that's a good question. Well, I'll tell you first and foremost, I have such little time to watch the news. I don't watch my local news, even though I'm on it like every day in some interview. It's actually a rule to keep my sanity in case they mess up a story and it doesn't make me mad. As I protect my heart rate is what I always say, and so I don't do a lot of it, but I read, and I'm very picky about the sources that I read, to be very honestly. So I haven't had a lot of that. I have been a little frustrated. I don't know that I could call out. I guess I could call out one of them. And actually, it was going to be a question I was going to ask you in your community because I don't know enough about it. But that website that's like the World Meter.
Oh, World of Meters. Yeah.
Yeah. So that one is being shared by a lot of people in my community. And I have no idea anything about it. I don't know whether to trust it. I'm always kind of a little bit skeptical, but I haven't had time to dig in. But I've seen a lot of people in my community sharing it on social media and using it to make these harsh policy statements and political statements.
Well, it's an interesting question because what I've seen and what I saw early on, like back when back in March, when we started really seeing that curve start to grow here in the US, is the accessibility of data, thanks to the work that Johns Hopkins did, which is laudable in a lot of ways for trying to bring a lot of different data together. Made it really, I don't want to say easy, but relatively straightforward for people to go ahead and stand up and do their own charts and graphs and build out their own kind of ways of visualizing and sharing that case information. And in some ways, this proliferation of all these case counts has frustrated me. I don't look at them every day because at the end of the day, they're not changing what I'm doing as an individual or a citizen, right? I mean, I sometimes look at what's happening in the DC area because that matters around me and that's local, but it takes days, if not a week, for those numbers sometimes to make it into national level statistics and reporting. And so I just find that the accessibility of the data in this case and the accessibility and the availability of data that's fundamentally flawed and incomplete is a real pain point for me, because I do think people go ahead and they screen grab that chart that they see as they're scrolling through a website or scrolling through social media. I've seen my husband pull up Google and be like, Google number of cases in the US today. And there's a little chart that pops up right there on your mobile device that Google's embedded now when you pull that up. And the accessibility of that information to me is just in such stark contrast to kind of the utility of that information for any kind of real decision making, whether it's at a local individual level or even at a national level. To your point on, we're going to have to treat this as a set of connected outbreaks really in the US, and how we manage it is going to have to be somewhat more local than with sweeping national policies about when we reopen the economy. So I know from a data visualization perspective, I always look at those kind of things. And if someone puts a chart or a graph on it people are more apt to believe it. And we know that from research, like people trust the objectivity of charts and graphs. And I don't think a lot of folks are spending a lot of time digging into those footnotes and disclaimers and everything else that tries to tell you, like, take a look at this, but like, be cautious and careful in how you use it to inform anything you're doing, which is, I think, a tough place to be in when those numbers are saturating the media all around you so much for folks who might have a little bit more time than someone who's trying to do all of their local policy making like you are. As you think about kind of things that you're hearing from your community and that you're wishing that was kind of more to the top, you talked a lot about earlier about trying to find ways to think about how to reopen and what this looks like economically. What are the kind of economic indicators or even the kind of anecdotes and stories and feedback that you're looking to try to inform that decision?
Yeah, that's a good question. I think from a true like economic perspective, I was on a conference call today with the Kentucky Chamber of Commerce. They had an economist from U of L on there, and he was trying his best to break down some of the economic impact numbers from a state perspective. And I appreciated the attempt, but that was the kind of information that I was really curious about. You know, with all these layoffs and all the people who are not participating in the labor pool, you know, what does that look like from an economic perspective? And from city government's perspective, you know, we live and breathe in our local government off of occupational taxes, which is based on payroll. We live and breathe off of business license taxes, and a lot of those things are down right now. And so from just a pure on how do you continue to have funds to function as a city government, what is the impact going to be to us? And we have no idea. I've seen some, there's an organization in Kentucky called the Center for Economic Development out of UK, and they have actually done some interesting work with credit card receipt data. And they've been able to kind of compare quarterly credit card receipts and then year to date and say, okay, this week, last year, this is what the credit card receipt data looked like. I have no idea what the source is, but I love the thought of being able to give that kind of information to us as local government so we can start to have some level of data to speculate on. Because at the end of the day, that's what this is we're speculating when it comes to the economic impact of what's happened.
Yeah, it's interesting. I saw an update from the JP Morgan Chase Institute. That's their kind of research arm that looks at aggregate level data about finances. That I only skimmed the kind of high level headlines, so I don't want to go spouting numbers here. But I do think that people who have access, or companies that have access to that kind of information, and even if they can provide some reporting on kind of what that looks like at an aggregate or high level, is the kind of research and data we need right now more than more case counts. I mean, we need better quality data on the case counts, but I don't know that I need to see one more dashboard that gives me a proportional symbol map of kind of where all the cases are happening with a bunch of red floating dots. So I think that looking to kind of what other information we're looking at is important. And I know you said earlier, and you and I have talked a bit before about the fact that healthcare is such a huge industry in your region, really. I mean, how is it possible to do social distancing when people are primarily classified as essential workforce and having to go to work, especially if it's at a hospital?
Yeah, that's a good question. I mean, we have two large hospitals that have thousands of employees each. I was just talking to the CEO of one of those hospitals today, and he's talking about Governor Beshear announced yesterday and confirmed it again today that as of Monday, they're going to start bringing back some of those healthcare functions. They're going to bring back diagnostic testing. They're going to bring back several other kinds of providers. And so that means you're going to have more people in their hospital. I mean, today, you know, really, even as of, well, I guess even still, when you talk to someone who's a healthcare worker, they'll tell you that the halls are empty at the hospital. And everyone's kind of looking around like, okay, what's going on? We're waiting for something to happen and it hasn't happened. So I don't think they've had such an issue with that, frankly, because they did, one of the hospitals furloughed some employees. I'm hoping they're going to bring those back with this kind of new opening situation they're going to have next week. So they haven't had as much of an issue as far as I have heard. And we haven't had a whole lot of healthcare workers, knock on a lot of wood, you know, actually become positive.
Good. Well, and I think, Brandi, you and I could probably dig into like the knock-on effects within health systems for a long time in terms of all the different ways in which we're going to see other indicators, whether it's on those elective procedures or routine immunization or other things that can be impacted, that I think having these early conversations about what things look like with COVID is really just the start of those conversations. And I can just imagine people who are doing their sociology degrees and other degrees in 10 years are going to be very focused on looking at this period in history for just what a unique unique time it was in terms of all the things that happened and trying to make sense of what it was. And I hope, if nothing else, that we're being thoughtful and mindful about how we're collecting data, the ethics, the privacy, all those pieces, but collecting enough data that someone can make sense of this current environment so that we can do better in the future if this ever comes to pass again, which I certainly hope doesn't happen in my lifetime.
I'm with you on that.
Yeah. Well, Brandi, it was great to speak with you today. Thank you so much for going ahead and connecting with us. Is there anything that, anywhere that if people want to stay connected to you or learn more about what you're up to as the mayor of Paducah, Kentucky, is there anywhere that they can find you on social media or otherwise?
Yeah, absolutely. I have a mayor's Facebook page. It's just Mayor Harless, City of Paducah. And then I also have a website, brandyharless.us. And then our City of Paducah website is just paducahky.gov. So yeah, I'm always happy to connect with anyone who is interested in kind of getting that more local perspective on from an elected leader. And I'd love to just tell you really quick, Amanda, too. I was thinking about, as you were saying, about the kind of face to the numbers. You know, in Paducah, one of the things that I just think is so valuable about who we are is we're such a generous community. And so from day one, we were constantly thinking about what are those populations in our community that need our support. And so I've just been very thankful of the generosity of our community. We've raised hundreds of thousands of dollars to be able to support each other. And so that's why I think the local perspective is so important, because it's really the trenches and it's really where all the work is happening. So thank you so much for having me. And I hope this was helpful to your viewers. And I always appreciate the conversation.
Yeah, and I just appreciate ending on that positive note about the fact that there are so many people coming together as communities right now, and the generosity in those pieces. And to me, those local stories are, I think, what bring a lot of us hope right now. So thank you for surfacing those and for all the work that you're doing in Paducah. It was great to connect, and we hope we'll go ahead and stay in touch and talk to you again soon.
Okay, thanks.
Thanks.